Good day, everyone. Welcome to our long test to rationalization, and I'm actually in charge to discuss the answers of the first two part, which is basically on C.1 and C.2. Let's begin with foundations of psychiatric mental health nursing, and I'm actually having 12 questions for this. Question number one. Nurse A is caring for a client from a different cultural background who expresses reluctance to discuss their mental struggles. What is the best response by Nurse A? So the question is best response. Letter A. I understand that cultural beliefs can impact mental health perceptions. Can you share what mental illness means to you? Or mental illness is a universal experience and you should not feel ashamed to talk about it. Or letter C, ignoring mental health concerns can worsen symptoms over time, so it's best to address them openly. Or letter D, let's focus on your physical health first before discussing mental health concerns. Of course, we know that we can eliminate options by means of polarities of choices. Let's eliminate letter B and C because it's actually stated negatively, and you should not ashamed, so you should not feel ashamed that is actually negative. And then uh, letter C is also negative because it says ignoring. So we're left with letter A and D. The best answer for number one is letter A because that's actually telling us that cultural belief has a strong influence over mental health perceptions. So in order for us to best validate the statement, so that is actually one way of encouraging an open dialogue or open conversation without possible imposing our own personal idea regarding cultural backgrounds regarding mental health. Mental health. The answer for number one is letter A. Number two, Nurse B is working in a psychiatric unit, understands that mental illness was historically viewed as a result of an imbalance in neurotransmitters. Letter B, a moral weakness or punishment for sins. Letter C, a behavioral choice influenced by environment. Letter D, a condition requiring only religious intervention. Of course, eliminate natin kagad yung letter D because it is absolute. So of course, it is not associated with only religious only religious interventions because we know mental illness requires a long-term treatment then. And then let's eliminate also letter C, choice influenced by environment. Of course, that is actually a condition that happens. It's because of the problems of our functions of the brain. But the question is historically, so it means that that is actually previous assessment before there is actually an evidence-based practice when it comes to research that is focusing on the newest view of mental illness, and which is basically on neurotransmitters. So the best answer for number two is letter B because in the past it is actually viewed as seen on demonic possessions, specifically for the process of sins or weaknesses that could possibly be leading to punitive treatment rather than focus on medical interventions. Number two, the answer is letter B. Number three, Nurse C is assessing a client for mental wellness. Which factor is the strongest indicator of good mental health? Letter A, absence of psychiatric symptoms. Letter B, high intelligence and academic performance or achievement. Letter C, ability to adapt to stressors using effective coping mechanisms. Or letter D, dependence on close family members for all decision making. Eliminate natin kagad yung letter D because that is total dependence. No? And for all, it means that is absolute. And then eliminate din natin yung letter A because it doesn't mean that you don't have the symptoms. You have no uh, that doesn't mean that you don't have any illness at all. And we're left with letter B and C. Letter B, high intelligence and academic achievement. Not That's actually not an indicator that you are mentally good or mentally well, because sometimes some other individuals has the high intelligence and academic achievement, but they have symptoms of psychiatric problem. The best answer number three is letter C, the ability to adapt to stressors using effective coping mechanisms, because we know that that tells us that there is possible resilience and adaptability, and at the same time, coping mechanism is actually involuntary in nature, that is utilized especially in response to a given stressful situation. Number three, the answer, letter C. Four, which factor contributes most to the revolving door phenomenon in psychiatric care? A. Increased availability of inpatient psychiatric facilities. Letter B. Greater awareness and acceptance of mental health treatment. Letter C. Advances in psychotropic medication, reducing hospital stays. Letter D. Deinstitutionalization without sufficient community resources. Of course, when we say door phenomenon, it means that there are actually many clients that are being discharged without adequate support in the community. That is actually a factor to consider, that might actually be a factor to consider, especially for frequent readmission in the facility. So the best answer for number four is letter D. So in letter C, advances in psychotropic medication reduces hospital stays. That is basically regarding the effect of this medication to the neurotransmitters. Then letter B, greater awareness and acceptance of mental health treatment. That is actually based on the acceptance of the family. And then, of course, there's a stigma, especially when you're going to be diagnosed with such. And then number four, letter A, increased availability of inpatient psychiatric facilities. This is actually in response to the door phenomenon in psychiatric care because of the frequent readmission of patients because of the lack of community support. Answer for number four, letter D. 5. Which client is at higher risk for experiencing mental illness? A. A client with strong problem solving skills and family support. Letter B. A client with a stress job but good coping strategies. Letter C. A client who has access to therapy and medication. Or letter D. A client with experiencing homelessness and substance abuse. Of course, alin ang naiba, which is only letter D. Now, because we know that poverty, abuse are basically factors of mental disorders. So we know that presence of homelessness, substance abuse, lack of resources, and social instability is a significant risk factor that increases the risk for possible mental illness. Number five, the answer is letter D. 6. Nurse D is caring for a client diagnosed with mental illness. Which statement best this reflects the medical model of mental illness? A. Your illness is a result of imbalances in brain in chemistry and genetics. Letter B. Your condition is a punishment for past actions. Letter C. Your mental illness stems from weak personal character. Letter D. Your symptoms are imaginary and you need to be more positive. Of course, we know that the present model of mental illness now, or the present focus of mental illness now, is basically on the imbalances of neurotransmitters now. So letter B is basically from the past. And letter B and C are actually from the past that might actually result in the possible demonic possession. And then when you talk about letter D, that is imaginary, it doesn't have any sense at all because that's already a reflection of having somatoform disorder. The best answer for number six is letter A, because we know that the medical model is actually explaining that mental illness is brought about by a biological disorder that involves the genes and at the same time imbalances of neurotransmitters. Number six, the answer is letter A. Number seven. Nurse E is reviewing the DSM-5 criteria for psychiatric disorders. What is the primary purpose of the DSM-5? Letter A, to classify mental disorders and assist in diagnosis. Letter B, to dictate the best treatment plan for each disorder. Letter C, to determine legal consequences for psychiatric illnesses. Or letter D, to assess the client's level of intelligence and personality traits. Of course, letter D talks about IQ test. So eliminate letter D. And then letter B, dictating, is highly authoritative. No, so that's actually wrong. And then the best answer is basically on classification and at the same time diagnosis. And sometimes majority of the focus of your DSM-5 is basically on guiding towards treatment. Number seven, the best answer is letter A. Number eight. What was one of the most significant advancements in psychiatric care in 1950s? Letter A, the institutionalization of mental health patients. Letter B, the introduction of psychotropic medications. Letter C, increased government funding for mental health problems. And letter D, development of psychoanalysis by Sigmund Freud. Of course, in 1950s, that's when the institutionalization is basically when it comes to rendering care towards the community setting. And then, of course, the focus of this one, and the development of psychoanalysis is before 1950s. And because of the development of psychoanalysis, it means that that is also the evaluation of the impact of neurotransmitters. That's why the neurotransmitters is the focus in 1950s, in which there's an introduction of your psychotropic medication. The best answer for number eight is letter B. And of course, we know that tharazine or the chlorpromazine is considered the first antipsychotic that was developed during that time. Number eight, bravo. 9. Nurse F understands that managed care in psychiatric nursing has led to increased access to high quality mental services. Letter B, greater emphasis on long term inpatient care. Letter C, cost containment efforts that limit mental health treatment options. Letter D, the elimination of the need for psychiatric hospitalizations. Of course, we know that when we say it is managed care, it means that that is focused on the financial obligation or the financial aspects of psychiatric nursing. So in this case, the best answer for number nine is basically on letter C. That is cost containment efforts that limit mental health treatment options. It means that the focus here is basically on making sure that the care that is going to be given is often leading to shorter hospital stays and access to treatments and at the same time specialists. Therefore, the answer for number nine is letter C. 10. Nurse G, a psychiatric nurse, is preparing a community education session on mental health disparities. Which statement is most accurate? A. Access to mental health treatment is equal across all populations. So eliminate this immediately because it's absolute. Letter B. Homeless individuals with mental illness receive adequate treatment. Letter C. Mental health treatment rates are lower for homeless and dual diagnosis clients. Letter D. Children receive mental health care at lower rate than adults. Of course, it is expected, no, that education or community education is basically pertaining to letter C because there's disparities regarding mental health treatments that are higher in homeless and dual diagnosis clients. Number 10, the answer is letter C. So it's actually high when it comes to mental illness and also substance abuse, no? And then that includes possible lack of insurance, transportation issues, and at the same time, limited availability of services. Number 10, Charlie. 11. A student nurse H expresses anxiety about beginning psychiatric rotation. Which advice from psychiatric nurse is appropriate? A. Avoid interacting too much with patients so you don't say the wrong thing. Letter B. It's normal to feel this way. Self awareness will help you develop confidence. Letter C. You should change your values and beliefs to be an effective psychiatric nurse. Or letter D. Focus only on medical treatments as psychiatric conversations can be difficult. Of course, eliminate natin kagad yung letter D because that's absolute. No? And then letter A is also eliminated because it's stated negatively. You don't say the wrong thing. The best answer for number 11 is basically letter B because the most important thing is basically on awareness, and that awareness usually boosts the confidence of the person to perform his or her responsibility in rendering care to a patient in her psychiatric rotation. 11, letter B. 12. Nurse I is caring for a client with chronic schizophrenia who has been admitted multiple times due to medication and adherence. Which intervention is most effective in promoting long term medication compliance? A. Providing detailed written instructions about the medication regimen. Letter B. Educating the client on consequences of stopping the medication. Letter C. Arranging for a family member to administer medication daily. Or letter D. Exploring the use of a long acting injectable antipsychotic medications. Of course, that is non-adherence of PO medication. Therefore, there's a need for us to give this patient medication that is going to give a long-lasting effect to the patient. So, clients with schizophrenia usually have struggles when it comes to adherence due to possible cognitive impairment and at the same time, the lack of insight into their specific illness or the acceptance itself. Therefore, it is important for the patient to receive a long-acting injectables that is to reduce the need for daily adherence and help prevent the possibility of relapse. The best answer for number 12 is Delta. Let's proceed now to the next topic, which is about neurobiological theories and psychopharmacology. Number 13. A 25-year-old male diagnosed with schizophrenia is prescribed dopamine blocking antipsychotic. The nurse understands that this treatment is based on which neurobiological theory? A. Reduced serotonin activity leads to schizophrenia. symptoms. Letter B, excess dopamine activity in certain brain pathways contributes to schizophrenia. Letter C, decreased acetylcholine levels cause schizophrenia-related psychosis. Or letter C, glutamate deficiency is the sole cause of schizophrenia symptoms. Of course, we know that when we talk about schizophrenia, that is actually having problems with dopamine. That's why we focus on the dopaminergic theory. So the best answer for this one is letter B, because we know if there is the dopamine hypothesis usually suggests that if there is actually an excessive dopamine activity in the mesolimbic pathway, that actually contributes to the positive symptoms of schizophrenia, and that is the presence of hallucinations, delusions, and of course, with the use of our antipsychotic medications, that's one way of blocking then the dopamine receptors that is going to reduce the presence of these symptoms with the patient. 13, the best answer is letter B. 14. A patient diagnosed with major depressive disorder asked a nurse, "Why did my doctor prescribe a medication that affects serotonin?" The nurse's best response is A. Serotonin helps regulate mood and low levels are linked to depression. Letter B. Your depression is caused by excess serotonin and this medication will lower it. Letter C. This medication increases dopamine, which is the main cause of depression. Letter D. Serotonin has no role in depression, but it helps with sleep disturbances. Of course, eliminate natin ang letter C and D because serotonin has a big role, especially in depression, if that is actually low. And then dopamine is specific for schizophrenia. So we know that our monoamine hypothesis suggests that depression is usually associated with low levels of serotonin and at the same time low levels of your epinephrine and dopamine. So that is why it is very important for us to give this patient an SSRI because it works by increasing serotonin availability in the synaptic cleft, improving the mood of the patient. Therefore, the answer for number 14 is letter A. 15. A nurse is teaching a student about the role of glutamate in psychiatric disorders. Which statement by the student indicates a need for further teaching? A. Glutamate is the brain's primary excitatory neurotransmitter. Letter B. Excess glutamate is linked to schizophrenia and neurotoxicity. Letter C. Glutamate plays a role in memory, learning, and synaptic plasticity. And letter D. Low glutamate activity has no impact on psychiatric disorders. Of course, what is being asked here is a wrong statement. No, so we know that glutamate plays a key role in the neuroplasticity and is involved in conditions such as schizophrenia, depressions also, at the same time bipolar disorder. So if there will be presence of low glutamate activity, this could actually be linked to cognitive impairments and depressive symptoms. So it has an impact. Therefore, the best answer is letter D. A, B, and C are correct statements. 16. A patient with generalized anxiety disorders is prescribed a benzodiazepine. The nurse understands that this medication primarily affects which neurotransmitter. Of course, we know that if that is benzodiazepine, that is used in reducing neuronal excitability. So if that is going to reduce neuronal excitability, therefore that will greatly affect your GABA or your gamma aminobutyric acid because this GABA is a brain's primary inhibitory neurotransmitter. So if there will be a low level of GABA that is associated with anxiety disorder, and benzodiazepine usually enhances GABA to promote relaxation and reduced anxiety. The answer for number 16 is letter D. C is for uh, specific for memory also. Number 17. A nurse is reviewing the neurological theories of bipolar disorder, with a group of nursing students. Which statement indicates correct understanding? Letter A. Bipolar disorder is primarily due to decrease in serotonin and norepinephrine. Letter B. Dopamine and glutamate dysregulation contributes to mood cycling in bipolar disorder. Letter C. Bipolar disorder is caused by solely environmental stressors. Letter C. Acetylcholine as deficiency is primary cause of bipolar. So we know that if we talk about acetylcholine, that is focused for individuals having myasthenia gravis. And then if you're talking about patients having bipolar, it means that it is brought about by problems of two neurotransmitters. And bipolar is not solely related to environment. So probably environment stressors is a factor for schizophrenia. So 17, the best answer is letter B, because there is actually an association of different neurotransmitters, that is dopamine, norepinephrine, serotonin, and glutamate dysregulation. So if there was an excess in dopamine and glutamate activity to the brain, that will actually contribute to the development of mania. On the other hand, if there is deficiency in these neurotransmitters, it can lead to depressive episodes. 17, the answer. Bravo. 18. The client diagnosed with major depressive disorder who is taking fluoxetine reports feeling confused, restless, and having elevated temperature. Which intervention should the client uh, psychiatric nurse implement? Of course, there's already presence of confusion and there's restlessness. Therefore, there's a need for you to think of the effect of that. Of course, we know that fluoxetine is a serotonin, selective serotonin reuptake inhibitor. Will you determine if the client has flu-like symptoms, instruct the client to stop taking the fluoxetine, recommend the client take the medication at night, or let it explain that these are expected side effects of the drug? Of course, uh, these are not expected. They require nursing interventions. So, for letter C, SSRI medication at night will not treat serotonin syndrome. So the answer here is letter B. Stop taking the drug because that's already an indicator that there is serotonin syndrome, considered serious complication of the administration of the intake of the drug, and that is producing confusion, restlessness, and anxiety. And if untreated, expected side effects can possibly lead to death. Answer for number 18, letter B. Instruct the client to stop taking the drug. That's B. 19. The client diagnosed with major depressive disorder. As a nurse, why did my psychiatrist prescribe SSRI medication rather than one of the other types of antidepressant? Which statement by the nurse is most appropriate? Probably A is probably it is the medication that your insurance will pay for. Letter B, you should ask your psychiatrist why the SSRI was ordered. Letter C, SSRI has fewer side effects and other classification. Letter D, the SSRI medications work faster than the other medications. Of course, since you talk about SSRI, therefore it talks about neurotransmitters, that's specifically in serotonin, and it will not talk about the insurance policy. And then in psychiatric nursing, avoid asking the question why. So letter B is wrong. And then, of course, letter D, that's also wrong because we know that if that's going to be the use of antidepressant, it requires you 2 to 4 weeks before its full therapeutic effect. The answer for number 19 is letter C, because we know that SSRI have the same efficacy with MAO and tricyclic depressants, but SSRI is safer because it doesn't have any uh, tachycardia and hypertension. And at the same time, it does not have any anticholinergic effects such as dry mouth, urinary retention, constipation, which is actually present of MAO. 19, letter C. 20. Which statement indicates that a client diagnosed with bipolar disorder is taking lithium understands the medication teaching? Select all that apply. Number one, I must monitor my daily lithium level. Number two, I will make sure I do not get dehydrated. Number three, I need to taper the dose if I quit taking it. Number four, I should take the medication with food. Number five, I will not eat foods high in thiamine. Of course, eliminate natin kagad yung number five because that is a specific per MAWE. Then eliminate din natin yung number one because the lithium level is monitored by a venipuncture, and we are going to collect blood, which must be done by laboratory, and it's not a test to be done at home. So number one and number five eliminate, and also eliminate number three because lithium should not be stopped because bipolar disorder is chemical imbalance and the client must continue taking the medication or manic behavior will actually return. Therefore, mali yung 1, 3, and 5. The correct answer is 2 and 4 only. So we know that I will make sure I do not get dehydrated because an anti-mania medication acts specifically on sodium in the body. So there's a possibility for dehydration. So it can actually, if the higher the sodium, the lower the uh, toxicity. The lower the sodium, the higher the toxicity. So the client should not become dehydrated. And then number four is also correct. I should take the medication with food because anti-mania decrease. This will actually going to decrease then the gastrointestinal upset. So number 20, that's letter B. 2 and 4 only. 21. The nurse is preparing to administer lithium to a client diagnosed with bipolar disorder. The lithium level is 1.4 millicoulomb per liter. Which intervention should the nurse implement? Of course, administer the medication, hold the medication, notify the healthcare provider, or verify the lithium level. So we know that the normal lithium level is zero point 0.5 to 1.0 in some books, or 1.1, and or zero point 0.6 to 1.2. So that's already 1.4. Therefore, that is near already of the pre-toxic level. So it's not already considered normal. So no need for you to verify the lithium level because that's a result. No need for you to give also the medication because that's already at the pre-toxic level. You can only hold the medication after the notification to the healthcare provider. 21, the best answer is letter D, notify the healthcare provider. So you notify the healthcare provider because the healthcare provider will then be responsible in ordering to hold the medication. 21, C. 22. The client admitted to the psychiatric unit diagnosed with schizophrenia is prescribed clozapine. Which laboratory data should the nurse evaluate? The client's clozapine therapeutic level, the client's WBC count, the client's red blood cell count, or the client's ABG result. Of course, we know that patients having this medication is clozapine is a typical antipsychotic, and it is not going to have an impact towards respiratory function. Therefore, no need for us to check for uh, the ABG. And then there's no such test as to detect whether therapeutic serum level of clozapine is available. So the best answer is letter B, because there is a possibility of agranulocytosis, and initially, clozapine is not going to be administered if the WBC is not available. So you have to check the WBC result before giving the clozapine. So if ever there's presence of flu-like symptoms within 24 hours of making the drug, then the client should contact the healthcare provider because these are signs of agranulocytosis, which actually indicate that it has caused a sudden drop in the WBC count, leaving the body defenseless, especially against bacterial invasion. 22, the answer is letter B. 23. The client admitted to the psychiatric unit experiencing hallucinations and delusions is prescribed risperidone. Which intervention should the nurse implement? Provide the client with a low thiamine diet, assess the client's respiration for 1 full minute, instruct the client to change position slowly, or monitor the client's intake and output. Of course, letter A is wrong because that's specific for MAUI. So we know that when you're taking this medication that's in a typical antipsychotic, so that might result into the possibility of orthostatic hypotension. And respiration is not affected by this medication. So the best answer for number 23 is letter C. Instruct the client to change position slowly because, as what I mentioned, this causes orthostatic hypotension. And if there will be presence of this orthostatic hypotension, it results into lightheadedness and dizziness, which can possibly be minimized by moving slowly when assuming an erect position. 23, the answer, Charlie. 24. This is a SATA question. The client diagnosed with general anxiety disorder is prescribed alprazolam. Which information should the clinic nurse discuss with the client? Number one, explain to the client this medication is for short-term use. Inform the client that rage and excitement are expected side effects. Tell the client that the client to avoid foods that are high in vitamin K. Discuss the importance of not driving due to drowsiness, or instruct the client to take the medication with at least 8 ounces of water. Of course, we know that alprazolam is basically an anxiolytic drugs. So there is a possibility of dependence, but the potential can be minimized by using the lowest effective dosage of for the shortest time necessary. So if there will be a presence of rage, excitement, and heightened anxiety, these are signs of paradoxical reactions, and that should be reported to the healthcare provider. So there's a need for you to discontinue the drug then. Number three, there's no contraindication for eating foods high in vitamin K. And then, of course, number four, benzodiazepine can easily cause drowsiness, so the client should not drive automobiles or use machinery. And there's no reason for us to increase the fluids. The best answer here is just 1 and 4. So the answer is letter B. That's 1 and 4. 25, last number. The female client taking lorazepam for panic attacks tells the clinic nurse that she's trying to get pregnant. Which intervention should the nurse implement first? Tell the client to inform the medication of since she's taking lorazepam. Instruct the client to quit taking the medication. Determine how long the client has been taking the medication, or encourage the client to stop taking lorazepam prior to getting pregnant. So, of course, it's very important that uh, the nurse is the question here is first, no? So it's actually going to be the first thing that you need to do uh, is for you to assess and determine how long the client has been taking the medication. The best answer for number 25 is letter C, because of course benzodiazepine, including the dosage, in order to determine if the medication can be discontinued abruptly or if it must be gradually decreased. So first is letter C, then second is letter B, and then the third one is letter D, then the last one is letter A. So 25, the best answer is letter C. So we're done. Thank you so much for your time. Congratulations to those who got good scores of this examination. This has been your long test to rationalization.